Let's be real. Chronic pain, not fun. But that's where Some Days comes in. Whether you're dealing with cramps, bloating, or you just need a little self care, Some Days has your back. Their products are designed to help you manage period pain naturally, from soothing balms to cozy heating pads that make you feel like you're getting a hug from your favorite blanket. And they're not just for period pain. A lot of people, including myself with endometriosis, have pain that's not only on our period, and it can be any time of the month, and it's not just abdominal cramping. I personally have a lot of back pain and a lot of leg cramping as well. Some Days Cramp Cream is great for all over body pain, muscle relievement. You don't have to power through the pain or pretend it's not there. Some Days is here to make sure you can actually feel good on your period and off your period. Trust me, you're gonna want to check them out. Head over to the website and use code Chronic Chronicles for 15% off your next purchase. Hi guys, welcome back to another episode of the Chronic Chronicles. I'm your host, Lexi Halloran. Today we are diving deep into trauma-informed healing with a very special guest, Dr. Danica Harris. Danica is a somatic experiencing practitioner, therapist, and coach who co-owns Empowered Healing Dallas, a group of therapy practice specializing in trauma-informed care. We'll be exploring how somatic experiencing can be a transformative tool in managing chronic illness. I'm super excited for this conversation and can't wait for you guys to learn more about somatic healing, therapy, and different coping skills for chronic illnesses. Let's dive in. Well, it's really nice to meet you. I'm super excited. I have been very excited to talk to you.
Oh, good.
Let's start out by having you introduce yourself and tell us a little bit about who you are and what you do.
I'm Dr. Danica Harris, and I am a somatic coach, and I co-own a private practice, a group practice in Dallas, Texas. It's called Empowered Healing Dallas, and we have 14 therapists now. I'm trained as a counseling psychologist, but at this point in my work, I'm primarily doing somatic work with folks, and that's because I'm able to incorporate both my therapeutic training, all of my experience as an SEP, and then I've also done some additional stuff like sound bath healing and Reiki training and stuff like
Ooh.
that. So I'm just trying to incorporate everything into my practice with clients. Yeah, so that's a little bit about what I do. I consider myself to be a complex trauma specialist. This is my jam. I love working with folks and healing. And I think my kind of essence to what keeps me going in this work is we need more gentleness. And I find that approach is lacking a lot in kind of, especially in the therapeutic space and the psychological spaces. I feel gentleness is lacking. So that's kind of my lens.
Yeah, I love that. That's super important. Yeah, you say gentleness and I 100% agree. Not to get too trauma dumping on you in the podcast, but I've been in therapy since I was 3, I think, on and off. And just for some things that happened in childhood or whatever. But for a lot of time, I have always just been therapy doesn't work. There's no reason that I'm in it. I didn't feel any different from it. And if anything, I never looked forward to going to my appointments. And I went through not numerous, but I mean, probably from 3 to middle school, I had the same therapist, or at least therapy office. I actually don't even remember if it was the same I think it was. I remember after therapy, my mom would always be like, okay, do you feel better? And I'm like, no, I don't feel any different. And I had a lot of anxiety as a child, growing up, and there were reasons for that. But I just never, my mom was always just like, okay, you still anxious? So you feel better? And I'm like, no, I don't feel better. I feel like it's pointless. You're spending money on something that doesn't work. But looking back on it, I think that there's a two-way street to therapy. One, I don't necessarily think I was in the headspace to want to do it. So there's a big thing behind that. I'm sure that you would agree, but and it goes for anything, but if you don't want to do something, then it's not going to help. So in reality, my mom forcing me to do that was not really doing any good because I didn't want to do it anyway. So I would go to those appointments and I'm not giving it what it needs to have. And
Mhm.
then two, like I always felt like I would come out of those appointments and I would have like so much like homework and I'd be like, oh my gosh, it's like a punishment. Like it's
Yeah.
like I'm anxious and then I'm punished and I have to go talk to these people and then they give me all these things to do and I don't want to do them. So now as an adult, like I'm 26 now and I feel like my frontal lobe has like fully developed and I'm like, oh, I probably should go back to therapy just because like it's just because I felt better doesn't mean that I am, you know,
Mhm.
recovered from everything. So, but now as an adult, I found like my therapist last year was just so much more like gentle. Like everything, she let me speak about things when I wanted to speak about them. It wasn't, I felt like therapy my whole life was a lot of like probing
Mm.
and it was like I didn't want to talk about things and they wouldn't let me like I would talk about things that I didn't want to talk about like in high school I would talk about, you know, anxiety with like my high school boyfriends and they'd be like, "Okay, this is not the problem though. Like we need to talk about your family." And I'm like, "I don't want to talk about that."
Yeah, that's tough for a teenager. Like, I mean, a
Yeah.
kid most of the time is going to talk about like what's right in front of them, not like the
Hmm.
bigger overarching issues. Yeah, so maybe that was like an unrealistic expectation your therapist had of like your child self.
Yeah, maybe. I don't know, but I really appreciate that you go into it with like a gentle mindset. So like what does that mean to you in your appointments?
Yeah, I mean, I think with, like, because up until recently, I was still seeing therapy clients. Like, it's only been this year that I've kind of
Yeah.
transitioned into like more of my somatic coaching. I think my approach as a therapist and a coach, my approach is similar with both. It's really like, I believe you. Like, that's the foundation. Like, you come in and I believe you. I believe your story. I believe your symptoms. I believe your experience of yourself. I believe your experience of yourself in your own body, in the world around
Hmm.
you. And I think that we have to start there because, like, a lot of times for us, I mean, I think all of us suffer from this, but especially complex trauma survivors, we have a
Yeah.
pretty often, we have a, and I put myself in this category before I did my own many years of healing work and continue to do that. We can have this like very negative outlook of ourselves, and that's so
Hmm.
protective when we're young. It's like if our environment is like chaotic or unsafe as a little kid, like we have to like internalize that, like, basically it's us and not the environment because we have to
Yeah.
survive it. So, kids end up internalizing this like really negative self-esteem and poor sense of self. And I think like when they show up in the therapy office or in these alternative healing spaces, they come in with this negative view of themselves. And I think it's very tempting, especially with talk therapy, that's like more of the top down approaches. So like your cognitive
Hmm.
and behavioral approaches, to want to be like, oh, well, let's challenge that thought. And like, I get that. I get why we would want to challenge that thought. But if we don't first acknowledge, this is my view as like someone who does trauma informed work, if we don't first acknowledge that like that thought was actually pretty adaptive,
Yeah.
that's how you survived a really awful environment, by believing it was you and your fault. You took
Hmm.
ownership and responsibility for stuff you shouldn't have because that's how you survived it. If we don't like acknowledge that first as your truth, we're not going to change it. And so to
Hmm.
me, it's like, let's not challenge these beliefs. Let's not make the person believe that like, oh, the way you see yourself in the world around you is wrong or inaccurate. Let's start by saying like, okay, well, the way you see it makes a lot of sense.
Yeah.
And maybe we can be flexible and gentle and expand that narrative you have about yourself and others so that you're not having to dismiss the younger parts of you that did everything they could to survive.
Oh my gosh. You just gave me like goosebumps. Yeah, I fully agree with that. And I wish that somebody would have told me that when I was like in high school and like going like my childhood going through these things because what I was met with was from like people in my life was you have such a victim mentality. Like
Yeah.
you're the victim and it's your fault and yeah, we don't have to
I
get super into that. But yeah,
hate that term. I
I
hate
hate
it.
that term. Like now as an adult, I find myself like something bad is happening at work and I'm like, okay, like I really do try to like look at myself first before I look at other things and I'm like, what could I have done better? Like I want to make sure that I am not in that like victim mentality and I'm like that is stuck with me my whole life. Like anything happens and I'm like, okay, Lexi, are you being a victim? Like can you look a little bit and make sure that you're not, you know, your boss is mad at you and you're not feeling bad for yourself. Like, did you actually do something that this could have resulted in that, you know? So Yeah, I definitely hate that word. Like as an adult now, like I think about things like how I treat other people, and I'm like, I never want, like, I would never say that to someone. I'm like, I would never
Right.
be like, oh, you're being a victim. I'd be like, no,
Well,
why do you feel that way? Like, what?
yeah. Well, and even like what you're saying you're doing now with work, it's like, yeah, we want people to get to to a place where they're like, okay, here's how I feel, here's what I'm experiencing. Let me expand my view of this. Like, what role do I play?
Yeah.
Is this actually really happening? Am I seeing this accurately? Like, do I need to take some responsibility for what's happening here? Of course, we want someone to get there. But
Yeah.
I think the language, it's like the approach can just be so different. Like rather than using the terminology victim mentality, could we just say like, well, it makes a lot of sense why you would default to this perspective that people are against you.
Hmm.
Let's start
Hmm.
there. And then again, from there, we can say, okay, so what's coming up inside of me is a trauma response. And the trauma response of I have been victimized before, and therefore I'm worried I'll be victimized again. So like
Hmm.
honor and acknowledge and like self-validate that part. And then also like, okay, now can I expand my view of what's happening here? If I look at what's happening as it exists right here, right now, without the lens of my trauma,
Yeah.
what part of this is mine, what part of this am I like maybe making assumptions about, it's but we have to like slow down, and I think we
Yeah.
can't slow that down if we're using like negative terminology about ourselves or dismissing the way we see something.
Yeah. It's almost like you're constantly on the, is it defense?
Yeah,
Yeah,
yeah, that's how I see it
probably.
too, like
Yeah,
constantly defensive. Yeah, and people are defensive when they feel like misunderstood.
for sure. And I feel like that is a lot of what it is, especially like when I think about like young me, like young Lexi, I'm like, why was I so like argumentative and so combative on things? And I'm like, I think I just always was like, I always felt like no one really understood what I was saying and no one really heard me. So I'm like, yeah, I was constantly defensive. And then I have people being like, oh, you're being a victim and why are you arguing everything all the time? And I'm like, no one understands what I'm saying.
Right.
So like that can be really frustrating.
Yeah, and when we don't feel heard, we get louder. And when our voice, like even getting louder doesn't work, then like our symptomology gets louder. It's like our
Yeah.
body's trying to get us to listen and we're trying to get others to listen. And if we're in an environment both like with others and with self, where listening's not
Hmm.
happening, we
Yeah.
just end up seeing a lot more symptomology, a lot more like self-dysregulation, dysfunction, health concerns, all of that.
Hmm. Yeah. So that's actually a really good segue. I want to talk, like, I have stage 4 endometriosis and I have quite a few other chronic health conditions, like throughout it's a long journey, but it's one that a lot of people with oh my gosh, chronic illnesses go through. It can be hard to understand like what's a symptom of a chronic health condition or like something that I'm actually in pain for. And then like somebody like me that has gone through like some form of trauma, it's hard for me to like figure out, is my body stressed out from like a trigger from something else? Am I like causing my own flares? Like I had my gynecologist for years, the minute that I, like opened up a little bit about what was going on in my life, she defaulted to, okay, you need to be on anti-anxiety medication and you need to be like on depression meds. And
Mhm.
that is what, like with my endometriosis, she was like, that's why you're not getting the correct results from the treatments I am getting you from endo. She's like, you have so much anxiety that your body is in constant inflammation and you're causing your own flares. And I'm like, but I
Mm.
don't like, for me, I have a little bit of trauma related to like medication. Like I have family members that will never get off of medication because they're on like so many and they have all these mental health things. And granted, like medication is great and for some people, but I just didn't want to be on them. I'm like, can we do an alternative? Like, I know I have anxiety, but I don't want to be on anti-anxiety medication. And there was a time where she actually threatened to withdraw care from me unless I went on anxiety meds.
My gosh.
So, and I was like 20. So I'm like, I don't know like what I'm supposed to say in these situations. Um, yeah, long story short, I did end up doing like depression meds for like 6 months. And then I was like, I feel like a zombie. Like, I don't want to do this. I don't think I'm depressed. So I did end up getting a different doctor, but where was I even going with that? Oh, yeah. It can be hard to figure out like what is what. So Do you have an approach when treating people with chronic illnesses? Like, what does that look like for you?
Yeah, and that's really common with
Hmm.
complex trauma, right? Like that your system basically, again, it's like all the physiology is talking to you
Yeah.
as an attempt to say like, hey, I'm trying to keep you in your body. You need to listen to me. So I see it a lot with clients that there will be like an experience of complex trauma and also chronic health concerns or complex health issues or what have you.
Yeah.
And yeah, I think, well, I hate the language that your doctor used that like you're causing your own triggers. Like,
I know.
like we are not ever causing our own mental health concerns. Like that's not real. We don't do that to ourselves. Now,
Hmm.
was there probably like a connection between your maybe mental health concerns or anxiety specifically and activation in the body leading to inflammation? Yes, that's probably
Yeah.
real. We're causing it by
Yeah.
any
Like I 100% agree with that too. Like I have a master's in science and bacteriology. Like I understand how
right.
your body works. Like I taught anatomy and physiology. I'm like, okay, yes. Looking back on it, I'm like, she had a point. Horrible bedside manner. I'm like, you had a point to that in saying that, with endometriosis, it's a widespread inflammatory disease. So your inflammation is already here, and then your anxiety is bringing it to here. So yeah, you're gonna have a flare. You could have said it like that. You didn't have to be like, this is, and then especially when I'm like 20 years old and I'm still in that mentality of like all that past stuff, I'm like, all I heard was, I am the reason that I have a chronic health condition. So that didn't go anywhere.
No, not helpful. Well, right. And it's like, obviously, it's so much more complex than that. Like our biology, our
Hmm.
genetics, our lived experience, like what our access to care has been, like all of that is so going to influence like our like today health and well-being. And yeah, I think, one of the things I'm often talking about with clients is this connection between nervous system reactivity. So if you're someone who lives in pretty chronic activation, somatic experiencing calls this a global high intensity experience. So meaning like global high, I'm always in high activation. So sympathetic dominant in terms of nervous
Okay.
system reactivity. So it's kind of like instead of being like in your window of tolerance, you're kind of always up above it or
Yeah.
rarely able to be like down in like where your nervous system actually can like
Yeah.
re-regulate. So if we're existing in this like global high intensity experience, then we're likely, everything in the body is probably like activated and turned on. And if our nervous system is in overactivation, our immune response is going to be too. And the way I'll kind of talk about it with clients, I mean, this is certainly not like a scientific sentence here, but like I'll kind of
That's
say like
okay.
you're burning through or blowing through your immune response. And
Hmm.
what we'll see is someone, I see this a lot, and this happened to me when I was in grad school too. Someone can like hold it together. I'm using air quotes there because it's like, how well are you at actually feeling functioning? Someone can like hold it together for a period of time. And then, like, at the end of the semester, at the end of a project, around the holidays, people will get sick or they'll have a really intense chronic health flare up. And it's because they've depleted their immune response and the body has been in like pretty intense dissociation. Then, when you
Hmm.
have a little bit of space, you're no longer in this like high crisis environment or high stressful environment and your body can relax a little bit. As soon as the body starts to relax,
Yeah.
you feel depleted.
No, that is so real. I have experienced that so many times, like so many times over. Insane. Growing up, my mom still to this day is like, you were the sixth kid. I don't know what. Like you were sick all the time. And
Mhm.
I still, as an adult, I get colds constantly. Like I'm still trying to figure out how to regulate my stress. The problem is that, and I realize this now, like with my brain fully functioning, I'm like, okay, my whole life I've been told you're chronically stressed. Like you're stressed out all the time. Like you need to breathe and not be stressed out. And I've never really been able to like relax. Relaxing for me is like literally editing a podcast episode while I'm watching TV with my boyfriend. And my boyfriend's like, can you just watch the TV? And I'm like, no, like
Mm.
I can't. And I'm like, I do feel relaxed, but I've always just been really high stress levels. It's weird for me though, like even saying that and admitting to that because like I don't feel stressed. For me to feel stressed, I'm always here. Stress normal is probably here, but I'm like for me to feel stressed, I got to be here. I have to be like on the verge of a panic attack and then I'm like, "Oh, I'm stressed." Like
Yep.
I don't realize it when I'm like normally elevated. So yeah, I feel like that is a big reason on why like I get sick all the time. And like if I do, sleep is a really big thing for me. Like I can tell, in fact, like recently, the past like 2 weeks, I normally go to bed at like 9 o'clock. In the past like 2 weeks, I've been not being able to fall asleep until like 11. I'm like, okay, I'm stressed. Like
Mhm.
something is going on that this is not, that's a big tell for me. That's like the only time now in my adult life that it can be like, okay, I need
Mhm.
to figure out what's going on because I can't sleep now.
Yeah.
So I did also want to ask you what SEP is. Can you explain?
So SEP stands for Somatic Experiencing Practitioner.
Mm-hmm.
And what that means is I went through this 3-year, 8 module plus like tons of individual work training with the Somatic Experiencing Institute. And
Yeah.
so they're the only ones that can like credential someone to be an SEP. And what that means is that I have experience and training in working with the body. So somatic work is considered bottom up. It's a bottom up approach, meaning that we are working with the body rather than the brain as the entry point. So our top down therapies, that's like cognitive behavioral therapy,
Mm-hmm.
more of the structured like question and answer stuff, things that like trauma timelines kind of fit in that, where we're like using the brain as an entry point into like getting to like what is the bottom of your symptomology. The bottom up
Okay.
modality, so that would be like somatic experiencing, sensio-motor, Hakomi, certainly like trauma conscious yoga, the sound bath sort of stuff, Reiki, all of that's going to work from the body first. And so a lot of times we're quieting the brain and
Yeah.
validating the brain, honoring the brain, saying like you matter, all these thoughts, the way you see the world, that's important, it matters. And we really need to hear from the body because trauma is stored in the body. Trauma
Mm-hmm.
memories exist in the body. And our nervous system is really what we need to tend to when it comes to, in my belief, what we really need to tend to when it comes to healing. Now, we can do that like through, really good trauma informed therapy. We can also do that through a variety of movement practices that someone can engage in on their own, or maybe even breathing exercises or, things that they can do at home. Or it might be stuff like body work that someone's engaging in, like intentional touch work or somatic touch work, something like that.
Okay. Yeah, that's really cool. I've heard of people going to like yoga classes and like being in a certain pose, and then all of a sudden they're just like crying and
Yep.
trying to figure out like why that happens. Is that kind of like, does that happen in your,
Oh, yeah. Oh, yeah.
yeah.
Yeah. It's interesting, like doing somatic coaching with clients. So
Hmm.
some of my therapy clients were able to discontinue therapy and move into somatic coaching. Or
Yeah.
they're seeing a different therapist now, and they're working just with me, the somatic coaching. But then I also have some folks that I've like never seen for therapy before. They're coming in for just somatic coaching. So I
Ooh.
don't know like any of their trauma story, and we're just working with what is. And
Yeah.
what'll often happen with folks if we're really doing some somatic work is they'll start to notice like, oh my gosh, like doing this, like, you're having me move my hands in a particular way, and all of a sudden I'm feeling tearful. And
Yeah.
it's funny because people will begin to like, I can see their mind coming in to judge. Like the mind's like, why is this happening? The mind's
Yeah.
like,
Why am I
basically,
doing
it
that?
makes sense, when really like it makes sense to the body. And so again, that's where that gentleness comes in. I'm just, letting folks know, like if you're having a release, that's because you're holding something that needs to be released. And we don't need
Yeah.
to get to the bottom of like, why is it when I'm just moving my hands like this, I'm feeling tearful? Well,
Yeah.
that might be something about some energy you're moving, or a, manifestation of a boundary you're creating. Like we don't really know why, but what we do know is
Hmm.
that you're having the emotional reaction, and that's what matters. So then we'll tend to the emotional reaction.
Yeah. And just let it happen. Move
Yeah,
through
let it
it.
happen.
Yeah. Um, Interesting. Yeah, that's really cool. Is there a role for somatic therapies in chronic illness?
Yeah, I think it's like the best. I do. Yeah, of course, everybody's going to respond to different types of approaches. And so I don't want to be like, oh, somatic work's like the end all be
Hmm.
all.
Yeah.
Um, but I do think, especially for folks with chronic illness, chronic health conditions, there tends to be this like relationship with the body that can be strained, like,
Hmm.
sometimes and I put myself in this category too, sometimes we can be all in on our relationship with our body. We can be really gentle with ourselves. It's like, okay, I'm doing all these things I need to do for myself to take care of myself. And sometimes there's like frustration or maybe like anger at the body, or you feel like the body's betrayed you, or, there's a variety of other feelings that can come up. And I think that that's where somatic work can be so helpful to strengthen the relationship someone has with their body. One of the things I'll often talk about with folks is like just even meeting basic needs. And like, it has surprised me so much over the years. Like when I ask someone like, how are you hydrating, nourishing, and resting your body? How are you listening to your bathroom cues? Like most of us aren't doing all four of those things well.
Mhm. Yeah. No, I don't. I'm terrible with drinking water. Like terrible.
Yeah, so like if we
Yeah.
start there, like just like our bodies need nourishment, they need hydration, they
Hmm.
need rest. We need to go to the bathroom when we need to go to the bathroom. If you're in uncomfortable clothes, like your body feels that. So it's like even just starting there with like basic needs, like can we work somatically on the basic needs and view that as like really appropriate self-care? And if we do that, are we, one, being gentle with ourselves, and two, strengthening our relationship with our body?
Yeah, those are all really good points. I feel like especially, I mean, I can't speak for everybody in the endometriosis community. I was angry with my body for a long time, and sometimes I still am. Like I feel like I've let go of that for the most part, but sometimes I still am, and I'm just like it doesn't, I don't want to say it's not fair because like things happen in life the way that they're supposed to, but there was a long time in my life where I was like this is just not fair. Like other people don't go through the pain that I'm going through, and it even now like I'm I do try to take care of my body, and I try to like eat a certain way, and I try to have enough water, and I decrease my caffeine. I love coffee, but I'm like I can have one coffee a day and then the rest is decaf because I just love the way that coffee tastes. I try to do all these things correctly for my body. I'm like, okay, I'll do like low impact. I really like running, but I can't run. Like it gives me flares. So I'm like, I'll jog or I'll walk. Like I feel like it's almost like I have to, bargain's not the right word, but like decrease everything that I want to do to like make my body happy. And then still I get a flare. Like out of randomly, I wake up and I look 4 months pregnant from bloating. And I'm like, why? I'm like, what did I do wrong? Like I felt like I did everything correctly. And you just think it just happens. Like you don't even know. So that I know that a lot of people with endometriosis deal with that. And it can just be so like frustrating and angry. Do you have any tips on how to like kind of not be so mad at your body? It's so weird because it's almost like your brain and your body are so disconnected when you have
You're
chronic
separated.
pain like that. And I'm like, I don't want to be mad at you, but I'm mad at you.
Yeah, I think what you just said is so key. Like our brain and our bodies are disconnected. And that's true for most of us, especially those of us who have complex trauma.
Yeah.
I think getting everything to be back in agreement with one another. So I would say integration's the goal with somatic work. I want someone to feel less dissociative, more integrated, more compassionate with themselves. So we don't so the part of you that feels mad, like that
Hmm.
part's like a survival part of you, like it's a
Yeah.
protective part. That protective part's coming in and being like, oh, I want you to be well. I want you to feel good. And I think it's like, well, I don't want us to dismiss that protective part. I want to say like, okay, thank
Yeah.
you. I know you want me to feel well. And then it's like the other parts of you saying, me too. And like, it's not actually my fault that I have a flare.
Oh, that's actually a really good point. You know, that reminded me of so this is so funny, but that comment just then reminded me of like we used to have these like stupid fights, and I'd look at him and I'd be like, "Why are you fighting?" I feel like we're fighting each other, but we're not fighting the issue. And I'm like, "Why are we fighting each other? Like we're mad at something, not each other. Stop fighting me."
Right.
And the way that you just said that made me think, okay, why can I do that in my relationship, but I can't do that with my own body? It is kind of like that. Like it's your brain and your body, and like, why are we fighting each other? We have the same goal.
Yeah, exactly. Yeah. But I think we're often taught that
Hmm.
especially if as a kid you were made to feel responsible for stuff that was going on, or if
Yeah.
like you were a kid that got reprimanded for, and I'm using air quotes again, like acting out,
Yeah.
then you would have come to believe like anything that's bad is my fault. So if I'm having a flare, it must be something I did. When really
Hmm.
okay, could it have been like something I ate had a reaction to my body? Okay, yes, is that possible? Sure. But it's not reasonable to say to people like, you can never do an exercise you enjoy again. You can never eat
Yeah.
these types of foods ever again. You can, people aren't, we can't really do, we don't do well when there's all these limitations, right? And we
Yeah.
might even say that's a different form or potentially could cause a different form of trauma. So I
Yeah.
think it's knowing that, like, there will be times that we do contribute to our own sense of well-being, but
Hmm.
that doesn't mean that it's our fault. It means that there's a reaction happening in our body and we can be upset about the reaction, but we don't need to be upset at our body.
Okay. Yeah. That's a good point. I'm gonna try to keep that in mind the next time I have like a random flare up and I'm like, why? I want to get into like some coping mechanisms type things. Before we get into strategies and stuff like that, I do want to ask you, what about burnout? That was something, and maybe it wasn't burnout. I'm not really sure because that's like such like a hot word on social media right now. But when I did grad school, I don't know, like I felt like this was only I graduated a year ago. So like my program, like the first couple of months, I was, like going to the doctor's office. I was doing the things that I was supposed to do. I was in like thinking about going, I did pelvic floor physical therapy for a while and that was rough for me. And then I was like thinking about going back because I was like, okay, maybe I like didn't give it enough of a chance. And
Mm.
I'm like doing all these things, staying really on top of my endo. And then, like 6 months into grad school, I was like, I can't do this. Like, one of these things has to go, and it's going to be you. Like, endo, I cannot be on top of you because like I was working, I was teaching, I was in school. I also was applying to medical school. So I was studying for the MCAT. And I'm like, I literally cannot, one of you have to leave. And this is the only thing that I like can't not focus on. So in my brain, I like now looking back on it, I'm like, I think I was burnt out, like with my chronic condition. I was like, I literally just don't have the space to deal with it. So my really bad response to that was literally ignoring it for 2 years. And I had flares all the time because like that's not possible for them to just go away because I told them to. But I didn't do anything that I like should have done to make them better. Like I was eating processed food the entire time. Like I was eating takeout most of the time or um like meals that you can just microwave because I'm like this is all it keeps me alive, so it's working. But yeah, those 2 years were really bad. And then like I had flares during it, but once I graduated and I moved to Washington and I started my job, the first like 6 months of this year were the worst flares I've ever had in my life. I'm like, what is going on? Like these are so bad. And I was having like insane flares, like like shortness of breath. My heart rate was insanely high, like all this stuff all the time, bloated probably every day for like 6 months. And I'm like, what the fuck is going on?
Hmm.
So I don't know. I know that earlier we talked a little bit about, like, you mentioned how you can almost like hold it together for a while. And then once you're like fine, it gets really bad. And I'm like, I wonder if that's what happened. I was still having flares, but then I got through grad school and then it was just bad after it.
Yeah, I kind of think of this as like whatever's at the top is going to get our attention, And so like
Hmm.
whatever we decide is like the top priority, that's where most of our like capacity and energy is going to go. And it's amazing how we can like dissociate from the other parts. So like
Hmm.
if your focus is I have to get through grad school, I could see where like when you'd have a flare, you'd maybe even like dismiss it or ignore it or overlook it or function through it because that's what you told yourself you had to do.
Yeah.
And our mind is extremely powerful.
Hmm.
Now, all the while, what's happening is your body's like, okay, I'll take the hit, I'll take the hit, I'll take the hit, I'll take the hit, right? And then over time that built up, and then your environment changed. So now what's top priority no longer is there. And your
Yeah.
body's like, well, I've been waiting for you to listen. So now you're really gonna listen to me.
Yeah, I've definitely been paying for that this year and lots more. I mean, I'm feeling a lot better now because I've like I think I've gotten to the point, which maybe that all needed to happen for me to get to the point that I am now and just like be ready to take on this and be like, okay, I'm gonna do this anti-inflammatory diet. I'm doing the things that like people have suggested. I'm not doing high intensity exercises anymore. Like I'm not gonna go like I'm not going to go run 3 miles because I was stressed out that day, because obviously that is not making my stress any better. But that's what I did in grad school. I was like, I'm going to go push my body, even though looking back on it, I'm like, why did I do that? Like, that was obviously not what my body needed. But I was over there like, oh, I'm bloated, I'm going to go run. That was
Mm.
stupid. But, that, of course, that's just like what I thought to do. Cause
I think you were like learning your body too.
yeah.
And like that's an important process. Like rarely is someone going to tell us what to do and we just do it and it just works, right? I think
Hmm.
like we also have to honor like the needs and desires we have. So like if there was a part of you that wanted to go run, like it's not
Hmm.
a bad thing that you went and did that. You just learned something about your body in the process. And like the unfortunate side effect is that you felt worse. And that
Yeah.
sucks, right? And like but again, that's not your fault. It's not you being stupid. It's that like you were honoring a different part of you, the part of you that was like, I really want to go run. That's going to feel
Yeah.
good, you know?
Yeah. I mean, it's all a learning process, right? Like, even now, like, I'm doing kind of trying to do an anti-inflammatory diet, and I'm like trying to remind myself that that doesn't mean that I have to cut out everything. I'm Because that's like a big part of it. Doctors are like, okay, cut out gluten, sugar, dairy, and I'm like, okay, I'm from the Midwest. Like, I love cheese. I love dairy. So I'm like, that's going to be a no from me. So I'm like trying to cut out like like dairy is such a huge food group. I'm like, I'm not going to cut out that entire food group. So I'm like, okay, what if I like take out, like certain things for a couple weeks and see how I'm feeling? I'm trying to like understand what types of foods are part of my flares. And there
Yep.
could be like for some people with endometriosis, food doesn't affect them at all. So I'm like, I don't even know if this will help. So, but I never felt like I had the time or like brain space to actually figure out if things affect me or not. And now I kind of do, which is nice.
Well, I like that approach so much better though. Like I think diet, I understand where the medical community is coming from when they're like, oh,
Yeah.
well, these foods tend to be inflammatory for people. But it's like, well, that doesn't make any sense.
Yeah.
Like, it's not that an entire food group, every single thing in the food group is going to be inflammatory to every single body. And so
Mm.
I think like having an anti-diet approach, more exploratory, like what you're saying, like maybe I don't have to cut out an entire food group. Maybe I can experiment with some things and see
Yeah.
like how does my body respond to this ingredient. I think that that's really a better approach. It takes more time, but
Yeah.
it's less likely to trip us up into diet mentality and eating disorders and stuff like that.
Hmm. Yeah. And that is also like, I have enough trauma, so I'm trying to avoid like
Yeah,
creating anything else. I'm like, I don't want to put myself in an unhealthy like eating pattern because, yeah, especially, and I have found, which I feel like most of the other human population, when you take everything out and you restrict yourself, like you're not happy anyway. I'm like, I'm not, it's
right.
so much harder to stick to something. Like, I love sugar. It is so hard for me to like go to bed without a sweet treat. And I'm like, why am I like making myself do that when I could make myself something that is still sweet? Like, just because it's sweet doesn't mean it has to be from like refined sugar. Like, I can add honey or maple syrup, or I can even just put like chocolate in it. Like, it's not bad to
Yeah.
do those things in my, and I like, I feel like, especially like social media is hard. It's hard. Like, people are like, there's always a new food that is like bad for you. Now I think now it's like eggs are bad for you, which I can like, yeah, they have a lot of like salt, whatever. But it's not like a uniform thing. Even with gluten, doctors tell you to cut out gluten because it's inflammatory. In reality, it's really only inflammatory to people with celiac disease, like most of the time. So I'm like, why are you telling everybody to cut out all of these things when you don't even know if they affect them or not?
Yeah. I mean, my belief on that is that it's lazy medicine. But,
Yeah.
that's where we have this disconnect. It's like the Western approach to medicine and to healing is like, focusing on like symptom
Mhm.
management instead of like getting to the root of the problem. So it's almost
Yeah.
like our Western medicine has a top-down approach, whereas like more holistic practices or functional practices have more of
Hmm.
that bottom-up approach, where it's like, okay, well, let's actually look at your body and your complete like
Yeah.
biopsychosocial and really
Hmm.
see like what do you need?
Yeah. Yeah. I very much agree with that. And I feel like the older I've gotten too, the more I have, like right now, I have a naturopathic doctor and she has helped so much more than my traditional like MDs have. And not that there's a place like a
For sure.
naturopath can't do my endometriosis surgery. Like there is a place for everyone in the medical field.
Yep.
But as far as like treating endometriosis or like whole body diseases, I found that like holistic practitioners are just so much more keen to listening to what's going on. Um, yeah.
Mhm.
Anyways, I want to talk about some strategies, which this is probably going to be my favorite part of the
Okay.
episode. Yeah, and I know that right now you are doing a lot more like of somatic stuff, so you can give whatever strategies you have for anything. What are some, I'm going to give you like an example. Say like I wake up and I'm having a really bad endo flare. I like get up and I'm like, oh my gosh, I'm so bloated. Like it's kind of like hard for me to breathe. And then I like go in the bathroom and I look at myself and I'm like, okay, well, the outfit that I pulled out last night was jeans and that's not going to happen today. What are some like coping strategies for kind of like going through, I guess like having your schedule changed without
Mhm.
you really being able to control it? Like, do you have any, because that's something that like also happens, or like I wake up that morning and I'm like, okay, like what I had planned for my outfit isn't going to work. And now, I need to figure out, I got to do some like yoga poses, try to get this bloating down so that I can go to work. What if I have to call out of work? Like, how do you cope with that type stuff?
I think first thing is asking yourself, like, well, validating the self first, of course, like,
Hmm.
oh, I'm not feeling my best today, or I'm really bloated and there's no way I can wear jeans. I think, like, I would say to someone, well, before that happens, let's identify 5 outfits in your closet that are your like default go to when I'm bloated, when I'm uncomfortable, when I'm hurting. These are the outfits I go to, because then we take the think work out of it. And you can even like put the pictures or put the outfits on and take pictures of it, right? So it's like,
Hmm.
then you have a folder on your phone, you can take all the think work out of it so that it's not like feeling crisis like in the morning when you're like, oh shit, my outfit doesn't work. I need to find something new, but you're already in some distress. And so like
Yeah.
I would want it to be easy in that moment,
Okay.
right? So like planning ahead and just knowing like, okay, like for myself, like when I'm having like a high pain day, it's a jumper. I want like
Hmm.
a minimal constriction. So I'm like in a
Yeah.
jumper and like maybe a little hoodie or something. And so like that's something I know if I wake up and I'm feeling like I'm in pain or I'm swollen or something like that, I gravitate towards that. And then I just don't even think about the outfit beyond that point. So I think it's like validating what's happening. And then second
Hmm.
is asking yourself, where can I soften? So I can soften by changing the outfit. I might be able to soften by like going in late to work. Or so like in the work
Hmm.
that I do, I'm going to look for all of the places that's not a clinical hour, like that I'm not with a client. And I'm going to say,
Yeah.
like, what can I shift in that? So like if it's, well, I had 2 hours of admin scheduled before my first client, I might say to myself, could I start an hour later and do 1 hour of admin? Because I can make up that right? Or I might say to myself, like, okay, I need to take a longer shower this morning because that's going to feel better. So instead of asking myself to do all this work in the morning, I'm going to just say, like, well, what's crucial, right? And so
Hmm.
I think that's kind of what we have to do. It's like looking in our schedule and saying, like, well, where can I soften? And
Yeah.
also knowing that if it's like I need to take the day off because that's what my like body needs, that's what I need to like feel restored or just even like gain back any capacity, that is a totally reasonable and viable option. And if you work for a job where you receive sick pay or sick leave, like that's what that's exactly for. If
Yeah.
you don't have a job where that's what you get, I think like asking yourself, like, can I tend to me now so I can make this up later? And of
Yeah.
course, not everybody's going to have that option. Finances certainly influence our ability to take time away. And I think, where can you flex then? Like, can I cancel everything other than my work day? And can I go into my work day like well prepared and comforted?
Hmm. Hmm. Yeah. That I love that. That's a good point. So, what are some like practical tips for managing maybe like anxiety with, I mean, I guess just in general, just anxiety in general.
I think like one of the things that happens with anxiety is we're already in some activation, right? Like our body is kind of like we're moving too quickly. So anything that slows you down is going to be helpful. And I think one thing that people will some in mindfulness, the like cognitive mindfulness approaches will kind of talk about this. It's like the sit stay meditations kind of stuff. Well, if someone's in high anxiety, asking them to sit and meditate, that's like not accessible at all, right? So I'm looking for like, when I say soften, I'm looking like, can we take the edge off a little bit? So if you're in
Yeah.
some intense anxiety, what do you need to discharge some of that anxious energy? And the brain may or may not have an answer, but like if someone's feeling wound up, I might say like, can we shake some of that energy out? Could we stomp around? Could we like wiggle and dance? Could I put on a song that I really enjoy and like sing
Mm-hmm.
and dance in my house as I'm like getting ready in the morning? Something to discharge or move energy. And
Yeah.
then we can slow it down. So again, I'm not necessarily asking someone to sit and meditate, but like could you listen to like a song that's like maybe higher intensity that you really enjoy, dance and wiggle or whatever feels accessible to you, and then could you listen to a little bit of a slower song, and like even
Yeah.
like that, you're using music you like, or it could be like sitting and watching something, or it could be whatever, but
Mm-hmm.
you're turning towards the mediums you already know work for you or that you like, and then using those as a way to help comfort. This is how we validate the self, soften, and also work with the system as opposed to like trying to force it to like collapse and to relax. Like that's probably
Yeah.
going to be very effective.
Yeah. No, 1,000% agree. And honestly, like that's so funny because when I taught in grad school, keep in mind these are like juniors and seniors in college, right? My students, it was a like a 3 or 4 hour lab that I was teaching. So they would kind of get like wound up every once in a while. And it would give me like I'm a very I don't know, I feel weird saying this, but like everyone in my family is like, yeah, you're very like sensitive and empathetic, like you feel people's feelings a lot. Um, I don't like say that very often, but I definitely do. And when I would be teaching and they would get like wound up, I'm like, I feel myself getting like anxious because like there's so much like
Yeah.
things going on around me. If they started to get like that and I would feel myself getting anxious about it, I would literally get on the microphone. I'd be like, okay, everybody stand up and like, we're gonna like shake. And I would make them like shake around. And yeah. And then I would be like, okay, are we chill now? Let's all sit down. Like, you got your energy out. And I'm
Mhm.
like, because you're making me anxious because you're giving all this like energy towards me and it's too much.
Yeah.
So, anyways, yeah, I think that that is really effective. I think that especially too, it can kind of get you just like out of your brain for a second, like moving your body, which is good.
Yeah, the goal is to, I mean, I think healing really happens when we can be in our bodies and we can befriend our bodies. But we have to like teach our bodies that we're safe, and we have to like show our mind that like it's not a threat if I'm actually embodied. And in fact, I'm going to respond better to my environment. But the brain is thinking it's saving you, right? So it's not trying to be a jerk. It's like it's just trying too hard. It's like muscling through, like white knuckling through healing. But really, if we can like invite the body in, and then the brain and the body can begin to communicate to one another, we're going to have better outcomes.
Yeah. Um, okay. Last, where are we at? Yeah. Maybe last couple, one or two questions for you. Okay. So this is more for like loved ones or people in your life.
Mhm.
What is some advice on how to support somebody with a chronic illness and like yeah for anyone like friends, family, loved ones, somebody who how can they support somebody with like chronic pain, chronic illnesses?
I think not challenging them, not assuming that like we know better than the person who is having the flare or the condition, and not assuming that that person like needs our opinion or advice. Like I think that people are really quick to be like, oh well, did you do this or did you do that, or it's just this or it's just that, when really it's like better to be like, what do you need, or how can I be there
Hmm.
for you, or like
Hmm.
that sounds really painful and that sucks. It's
Yeah.
like, what can we do? We can validate and we can ask how we can be of support. We shouldn't be asserting ourselves on to others ever, really, for any reason.
Yeah. Yeah. 100% agree. That would be really helpful. Yeah. Okay. Is there anything else that, well, first of all, where can people find you?
So people can find me on Instagram at The Empowered Therapist, or they can find my somatic coaching practice where I do retreats and courses and somatic
Ooh,
coaching.
retreats.
Yeah, I have a retreat coming up this fall and I'm super excited about.
That sounds
Um,
fun.
yeah, it's great. It's a like a very intensive and immersive healing experience, but we work
Mhm.
at the pace of people's nervous systems, of course. Yes, we've got that. And then like we've got twice a month, one of my colleagues does a somatic movement and meditation group. So it's like a drop-in thing that people, if they're interested in somatic work and they want to do that alongside their therapy, they could come and take part in that. And then also
Mm.
folks can learn about my therapy practice, Empowered Healing Dallas, and that's the handle on Instagram and also the website.
Mhm.
I've got amazing trauma-informed therapists on our team. So if someone's looking for more of like the traditional therapeutic approach, actually, a number of our therapists have additional training in like EMDR and somatic experiencing and things like
Yeah.
that. Yeah, those are the places.
Okay, perfect. So I will link all of those things in the show notes too. And then is there anything else that you would like to say or touch on before we wrap up?
I think the takeaway I would just want people to know is that like you make sense
Oh,
and the messages your body is trying to send you are really trying to help you be in your body and keep you safe, and that healing is possible and that we can have a better relationship with our body, and that even if that does not like eradicate some of our symptomology, it will help us know how to show up for ourselves better.
that's beautiful. I love that. Yeah, I'm gonna make that like my phone wallpaper. Like you make sense. I love that. Thank you. Thank you so much for coming on the podcast. This was great. I hope that I know this hour just like flew by. I'm like, whoa, how did we get here? Thank you. Thank you.
Sure, thank you.
That wraps up another episode of the Chronic Chronicles. Thank you so much for tuning in today, and thank you so much for your continued support in building our community and continuing to raise awareness about complex chronic illnesses. Please make sure to follow, subscribe, rate, review this podcast, and also follow us on Instagram at Chronic Chronicles Pod. I really love connecting with you guys, and I can't wait to chat again soon. Bye.